How are you?
I'm not feeling well.
You don't look so good. Have you been to a GP yet?
What is a GP?
A GP is your local doctor in your neighborhood. In Australia, the local doctor is called GP or general practitioner. A GP looks after all parts of your health. You can go to a GP to have a checkup to see if everything is okay.
And what will a GP do?
A GP is a good person to go to find out about your health and sickness.
How can I find one?
You can find a GP in a number of ways. Ask your friends, family or your neighbours. Look under medical practitioners in the yellow pages. Call Health Direct on 1800 022 222. Ask your community health nurse or ask at a local chemist.
We go to Dr. Jones. He's very nice. I have his telephone number in here.
Have you got a Medicare card?
You can get a Medicare card at a Medicare office. You need a document to prove that you are a permanent resident. The document you need could be a passport or a visa.
Yes, I keep it at home.
You must keep it in your purse. It is important to keep it with you at all times.
Yes, also you have to take your Medicare card to see the GP.
Have you had your blood test to check your iron levels? Remember, the migrant health unit and the community nurse says to do that.
But I do take my iron tablets every day.
You still need to check. A GP can arrange that. Make an appointment when you get home.
Okay.
I will come with you and then we can do it together.
Thank you.
You're welcome. Here is Dr. Jones' telephone number.
Okay.
Boulevard Medical Centre, can you hold please?
She's not there.
Just wait.
Hello?
Thank you for holding. May I help you?
Yes, please. I want to see Dr. Jones.
Does tomorrow at 2 o'clock suit you?
Yes, please.
What's your name?
My name is Deborah Kakai.
Always make the booking in the name that's on your Medicare card. This will be the name that your medical records are filed under.
That's fine. See you tomorrow at 2.
Okay, bye.
I can come with you to show you where the doctor is tomorrow if you would like.
Okay, that would be nice of you.
Okay.
If you have more than one problem, or if there is more than one person to be seen, you will need to make a longer appointment with the GP. Routine appointments are usually 10 to 15 minutes long. Tell the receptionist if you need more time.
Hi, can I help you?
Yes, please. I'm here to see Dr. Jones.
Certainly. Do you have a Medicare card on you?
Yes, please.
Thank you. There you go.
How much is it going to cost me?
We are a private practice, so payment is required today. It will be this amount, and then you can claim this amount back from Medicare.
Okay.
Do you have a healthcare card?
No, I don't have one. What's her health care card?
A healthcare card is a card that Centrelink gives you if you don't earn much money. It can make going to the doctor cheaper.
Okay.
So this is your first visit to the GP?
Yes, please.
I'd just like you to fill out this patient information form. Do you need any help filling out this form?
No, it should be fine. I will help her.
Okay, thanks. If you'd just like to fill it out over there in the waiting room, and the doctor will call you when he's ready.
Okay.
Thank you.
Thank you.
There are many different ways medical practices charge. Ask the receptionist how they charge when you make the appointment. Most of the visit is paid for by Medicare. Some GPs bulk bill, which means you need to have your Medicare card and healthcare card with you, and you do not need to pay any money to the GP. Some GPs charge more than Medicare will pay them. You then pay the difference. This is called the gap. The receptionist will tell you how much it is. For other GPs, you pay the full fee for the visit first. You can then go to Medicare to get some money back. Ask the receptionist, a pharmacy, or the Medicare office how to do this. To find out if you are eligible for a healthcare card, contact Centrelink. The Centrelink multilingual telephone number is 131202, or you can go to a Centrelink customer service centre near you. When you first see a GP, you will need to give the receptionist some information for their records. This information is private and confidential. This means that only the medical staff will see this information. If you need help with filling out this form, ask the receptionist or bring a friend with you.
Amudi Kakai. Good afternoon. Come this way. Hello, Moody. I'm Patrick Jones. Pleased to meet you. You're obviously not Irish like me.
No, I'm African from Uganda.
How long have you been in Australia?
I've only been here 6 months and my friend Bon told me about you.
Well, what can I do for you?
A GP has different ways of asking why you have come. For example, what brings you here today? How can I help you? This is when you tell the GP why you are there. You may find Australian GPs very direct. This is an Australian custom. It is not meant as rudeness.
My doctor at the Migrant Health Center told me to be taking iron tablets and my nurse advised me to have my blood level tested.
Well, I assume that he found that you were anemic. I'd like to ask you a few questions about your general health and some questions specific to anemia. And then I'd like to do an examination of you. Is that okay?
Yes, doctor.
The GP will ask you if you would allow him or her to look at you. This is called an examination. The GP will say if you need to stand, lie down, or remove any clothing.
Well, Muti, your eyes are pale, and I think you're still anemic. So I want to repeat some blood tests on you, and in the meantime I want you to continue taking your iron tablets. I'll give you a form to have the blood test done at a laboratory nearby, and you will need to take the prescription for the iron tablets to a local chemist and fill that. And I will see you back in 3 or 4 days when the results of the test have come back, if that's okay.
You need to see me in 3 days' time and take my prescription to the chemist. Is the chemist the same as the pharmacy?
Exactly the same.
Okay. And then I come back to see you. And I've got my brother who is coming here to Perth in 6 weeks' time, and I need him to come and see you. Is that okay?
That'd be fine.
His problem, he doesn't speak English. I don't know how you communicate.
Well, don't worry about that because we can organise an interpreter service for him.
TIS is the Translating Interpreting Service. Phone 131450. This interpreting service is free and confidential for permanent residents. Telephone interpreting is available 24 hours a day, 7 days a week. If you need an interpreter to come with you to the GP, you need to ask your GP to book one for you at least 2 days in advance. Everything you tell a GP is confidential. They cannot tell anyone what you have told them without your permission. GPs are used to talking to people about very sensitive or embarrassing problems, including very personal problems. You can talk to a GP about anything. You can take a friend or relative with you when you see the GP. You can ask to see a male or female GP if one is available. It is usually best to always see the same GP, but you can see another if you want.
Thank you, doctor. See you next time.
Lovely to meet you.
Thank you. How will you be paying for that today?
Here you are.
Thank you. I'll just print out your receipt.
Okay.
Thank you. You can get most of that money back from Medicare. You just need to take this receipt and your Medicare card.
Okay. Thank you. I need to make an appointment to see the doctor in 3 days' time.
Okay, I'll just check you. Does the same time suit you?
Yes, please. Please.
No problem. I'll just write that down for you. There you go.
Okay, thank you. Where do I get the blood tested?
Yeah, you just go out this door and down the corridor to the door on the end and just let the lady know that you're there and just wait in the seats provided.
Through this door?
Yes.
Okay, thank you.
Thank
See
you.
you next time.
Bye.
Is everything all right?
Yes, everything is fine. The doctor was very nice. I have to go and have my blood test and then I have to take this. I get my medicine.
Okay, so let's go to the pathology now.
Oh, good idea.
Most tests are paid for by Medicare. Sometimes you will need to make a small payment.
Can I help you?
Yes, please.
Do you have a prescription?
Yes.
Thank you very much. Do you have your Medicare card, please?
Yes.
Thank you. Do you have a healthcare card?
Not yet.
It won't be too long for me to dispense this prescription. If you'd like to take a seat.
Thank you.
Okay, thank you. Amuti, your prescription is ready. Okay, the doctor has prescribed these tablets. They're iron tablets. You need to take one each morning, usually with some food or some orange juice. Okay, if you could just sign that there for me, please. And here's your Medicare card. They're $6.95.
You will have to pay for medicines. Healthcare cards give you a discount on some GP prescribed medicines, making them cheaper.
Well, that all went okay, didn't it?
Yes, it wasn't as hard as I thought.
Yes, I told you.
Another thing I was wondering, what if I need to see the doctor and the doctor is not there, like on a weekend or public holidays or night time?
There are other places you can go at night or on the weekend. Health Direct is a good place to start. Ring this for 24-hour health advice over the phone. A nurse will answer your call. The nurse can advise you on what action to take, like going to see your GP the following day, going to the chemist, or go straight to hospital.
There are also 2 GP after-hour services in the northern suburbs. One is at Joondalup Health Campus and the other one is at St. John of God, Subiaco. I have used both of them and it was okay. This is similar to visiting a GP during the day. You need to take your Medicare card and healthcare card with you, and you need to pay for these services, and you can get some money back from the Medicare.
Some hospitals have emergency departments. You only go to emergency at the hospital if it is a crisis. This is a free service. Doctors see the people who are the most sick first. If it is not urgent, you may have to wait for some time. In an emergency, go to the nearest hospital.
Remember, if it's real emergency and you need an ambulance to take you to the hospital, ring 000 and ask for an ambulance. If you join an ambulance fund, or have private health insurance, it will be free. If not, you will receive a bill in the mail to pay later.
Thanks for explaining all this to me. It's different from what I've known before. I will be able to get medical help now.